Good evening. Welcome to our special event, Coping with COVID, Mental Health Solutions for Kids. I'm John Dankosky of the Connecticut Mirror, and this program is a partnership between the Mirror, an award-winning nonprofit online policy and politics source, which is based in Hartford, Connecticut, and the Gannett Newspapers of New England, a collaborative collection of award-winning papers spanning our region and, of course, the nation. And the sponsor of tonight's event, the Solutions Journalism Network. Now, as journalists, we're trained to root out many of the problems that people face in our society, and we will continue to do that. But the network helps give us the tools to focus on ways to make things just a little bit better in our world. So thanks to them for their support of this project and so many projects like it across the country. This past year, which was spent in a pandemic, it's changed the lives of so many of us, but those changes might be felt most acutely by children. Their routines of family life and social life and learning, they were all upended. We've heard about a lost school year, but what about just a lost year for kids? The problems weren't just felt by those with the most acute mental health disorders, but we do know that for those children, many supports weren't in place before COVID. So what are the solutions? Tonight, we're going to dig in and answer some of your questions with our panelists. Joining me is Randy Silverman, the executive director of the Youth Mental Health Project. It's a Connecticut-based charity that has branches in 5 states. The project's goal is to change the conversation and raise awareness that kids can struggle with mental health, and it works through its parent support network. Randy, welcome to our program. Thanks so much.
Thank you. Thank you for having me, John.
Also with us is Michelle Doucette Cunningham. She's executive director of Connecticut After School Network. It's an organization that's devoted to developing the whole child, as she tells me. The network is also home to the Social Emotional Learning Alliance for Connecticut, and we'll be hearing more about social emotional learning. Michelle, thank you so much for your time. I really appreciate you being here.
Thanks. Happy to be here.
We're going to hear from our 2 mental health experts in just a moment, and they'll be taking some of your questions. I'll let you know how you can ask your questions in just a bit. Also with us is Adria Watson. She's education and community reporter for the Connecticut Mirror. She's got a big story out, which you can read at ctmirror.org just today. It's about a growing number of children in psychiatric need and the shortage of proper care facilities and services for them. We're going to hear her story in just a few minutes. Adria, welcome.
Thank you.
And Laura Damon is here. She's a reporter of the Newport Daily News, which is part of Gannett New England's extensive project on childcare issues as part of the Solutions Journalism Network project. Laura, welcome. Thanks so much.
Thank you. As
I say, in just a moment, I'm going to give you some information on how you can ask your own questions of our panelists. We do have a chat function. There's also a Q&A function where you can drop your questions. I'll give you a little bit more details in just a moment. But Laura, I want to start with you and talk about your story for the series and just what you've been hearing from people as you talk to mental health experts, to parents, to students across New England. What are they saying about the state of children's mental health?
Sure. They were saying that it was an issue before the pandemic. I think that was a big sticking point with a lot of the people that I talked to. So my story was born out of this idea that technology was, before the pandemic, technology was causing or exacerbating mental health issues with kids. But then COVID hit and we had this huge reliance on technology, or a heavier reliance on it. And so the same place where these problems were coming from had to be the place where we were finding solutions to. So I focused on 2 organizations, the Youth Mental Health Project and the Trevor Project, because they had crafted tech solutions that were launched during the pandemic to try to solve some of these problems associated with mental health in children.
We're going to be hearing more about the project that Randy heads up in just a minute. Tell us a bit about the Trevor Project.
Yeah, the Trevor Project is, it's a suicide prevention crisis intervention organization. It's specifically geared towards LGBTQ youth. And they used AI to supplement their crisis counselor training, which was pretty neat and was one of the innovations that I highlighted in my story.
Talk more about this idea of how technology that is so prevalent and present in children's lives has been the cause of so many problems in mental health, and now is being thought of as the solutions. What were people saying to you about the root causes of technology and mental health problems or disorders?
When it comes to technology, they were saying, honestly, we didn't get into it too much pre-pandemic.
Mm-hmm.
It was mostly in terms of technology. They were saying, it was the youth suicide rate and suicidal ideations have been an issue. They didn't point specifically to technology, though, these experts that I talked to for my story.
We heard in your story from a pediatric physician at the Providence Hospital saying, quote, there's a massive pandemic of mentally ill adolescents to the point where 3/4 of the patients in the hospitals were adolescents who wanted to hurt themselves because of mental illness. That's a shocking number.
Mm-hmm. Yeah.
I mean, tell us a little bit more about that as you talk to people from across New England. Were you hearing some version of the same thing, essentially an epidemic caused by this pandemic?
Yeah, I would say so.
So how does that play out in a hospital like in Providence? Are you talking about overcrowded hospital beds? Are you talking about just not enough services for kids who have mental health problems?
Yeah, both. Yeah, crowded beds, not enough services.
And, you also say that new research out of the University of New Hampshire reports that more than half of kids in high-risk populations in the U.S. aren't receiving behavioral health services that could help them. Researchers used data that was collected pre-pandemic. So what that tells me is, there's a huge problem in American society even before this pandemic, and the pandemic just exacerbated the issue.
Yes.
So talk a little bit more about some of the solutions that you heard from people as you were doing your reporting. What really stood out to you as you talked to people?
I would say access. That was a big one. There's limited access to a lot of these services, and I think technology was a way to bridge that gap, especially with virtual therapy. I think I was hearing from a lot of people that parents are important too. So it's important to support the parents, as an organization like the Youth Mental Health Project does with something like the Parent Support Network. And stigma was a big thing too, as in terms of a barrier to youth mental health care and support.
So Randy, let me bring you in. Laura profiles you and your organization in her piece. Maybe you can pick up a bit on what she said. Obviously, this is stuff that you've been dealing with and working on for quite some time. What stands out to you about some of the reporting that we've heard of all of these problems happening all across our region?
Well, I think you hit it exactly right, which is that this is an epidemic. Now, I would tell you that it was an epidemic prior to COVID-19. The statistics in the studies show that 1 out of 5 children in our country struggled with a diagnosable mental health disorder prior to COVID. That was 18 million children, thereabout. And that was before the pandemic. So of course, there are new studies coming out, and we will be studying this for a very long time to show that the impact of the isolation, the at-home schooling, the lack of socialization that kids are experiencing, it has done such a disservice and has been detrimental to the mental health. And if you think about it, our children, they need socialization. Part of school is not just about learning, but it's learning how to socialize and how to react with other humans and how to express their emotions and their thoughts and their feelings. And if you're stuck at home, how do you do that? And so what we are going to see is an increasing crisis in terms of the mental health of our children. And one thing I'd like to state is that sometimes I think people feel, well, when COVID is over and they're back to school, everything's going to be fine. And what a lot of people don't realize is that this has been a year-long or more traumatic event. And this type of trauma is going to take a long time for our children to deal with. And so I do want to urge people to understand that it's not going to end the day they go back to school. Our children are going to need support for a long time, for the children of this generation. And statistics are showing, I don't know if this was, I'm sure this was in your reporting, suicide is the second leading cause of death starting at ages 10 years old all the way through 24. And that was before the pandemic. And so we really are in a crisis right now. And so the one silver lining, if there is any, and I hate to give COVID any silver lining, is we're having these conversations where we are really recognizing as a society how important it is that we pay attention to our kids' mental health.
And it's interesting too. I mean, you talk about all the things that were affected, and I mentioned this earlier. It's not just schooling; it's so much about the socialization in their life. I will say that we have focused quite a bit on the learning, the educational impact, and as I turn to Adria in just a minute, that's a big part of the work that she does. She does education reporting, but it seems to me, Randy, like what you're saying is that all of this other stuff, just the day-to-day lives of children, having nothing to do with whether or not they're learning math and science, are really what has been impacted here.
Well, and I've said this for years, your child has his or her or their entire life to get an education. And I'm not saying education isn't important, of course it is. But if they don't have mental health, positive mental health, if they're not well, whether they're educated or not, or how far they go in their education isn't relevant. There are mental health disorders that are very, very difficult to live with. And you can live healthy, wonderful lives if you have a mental health disorder. But if you don't get care for it, like with any other physical illness, the harder it becomes to manage and maintain. And getting back to, we were talking a little bit about stigma. Part of the problem is that there's so much stigma around it. We have not wanted to talk about kids having mental health challenges. And so that's left this massive hole. Half of all lifetime cases of mental health disorders start before the age of 14 years old. And again, that was true before the pandemic. And so starting to learn how to talk about the mental health of our kids, recognize signs and symptoms that they may be struggling. What do we do about that? How can we access help? How do we improve access to help? Those are the issues we really need to dive into. And yes, it's sad what's happened in the education, but with their education, they've lost a year of education. They can make that up. You can make up your learning. Kids take a year off all the time. I'm a parent, and my son lost 2 years of school when he was very ill with bipolar disorder. And the truth is, he made that up eventually. He did graduate from school on time, and he did all of the things he needed to do. But there was a period of time where he might not have survived at all. And that was the most important thing. How do you get your child to be thriving in life is much more important than are they getting A's, B's, or C's on their math test.
Michelle, but before we turn to Adria for her story, I'm just wondering if you want to pick up on any of that, if there's anything that you heard from Laura or Randy here that really resonates with you.
I think we really are picking up on the need to look at children as whole people. They're not only students, they are children, they are individuals, they have their own personalities, their own needs, and their own experiences. And we have to remember that for some children, school is the safest place they can be. It's their place where they become validated, where they have friends, where they are safe, where they're nurtured. And not having that for some children, that alone has been traumatic, let alone the experience all of us have had living through this year. So I think that by looking at children not only as students, but as individuals, as people, and people within a family setting, a community setting, we really have to look at them in the different environments in which they live if we're going to craft solutions that can help support them.
Yeah, and among those different environments, there's the very real fact that for some kids, school is a safe place and home is not. And for many other kids, that's reversed.
Right.
Where, you know, it's not a great thing to go to school. We've heard, Michelle, from plenty of students and parents who've said this year of not having to go in and get bullied, not having to go in and deal with some of the social problems has actually been one of the best years of my son or daughter's life.
I'm sorry to interrupt, Michelle. I was just thinking about how fascinating it is. We run support groups for parents, and some kids who struggled with social anxiety or school refusal really have done better during COVID without the external pressures of school. And it's interesting to see those differences. And Michelle, I'm sure you're going to say the same thing. I'm sorry I interrupted you.
Go ahead, Michelle.
No, I think that's exactly right. We have to look at children in their setting and within their experience and recognize that they're all going to be different. That, you know, there are introverts and extroverts. There are people who have been desperate to talk to other people and could do it all day long. And there are other people who would be happy to not talk to another soul all day long and be just as happy. So, you know, in that continuum, all of that is normal. And we have to make sure that we craft solutions and, you know, improve our systems to meet the individual needs of individual children.
So Michelle and Randy, stand by for a second. I will tell the folks who are watching along, if you have specific questions, I know a few of you have dropped questions into the chat field, which is absolutely fine. We're monitoring that. But if you want to ask a specific question, you can go to the bottom of your little Zoom screen. Everyone's very familiar with Zoom these days. And you can click on the Q&A function and you can enter your question in there, and I'll get to just as many of them as I possibly can. I want to turn to Adria Watson, our reporter for the Connecticut Mirror. And maybe, Adria, you can talk a little bit about the story that you have in the Mirror today. It's a very important story, and very much like Laura's, the problem that you're reporting on is something that pre-existed COVID, but clearly COVID has exacerbated the issue. Maybe you could just describe a little bit about what your story tells.
Yeah, so this story just, you know, there had been reporting about, you know, kids who were waiting in emergency departments, and there were 20 kids waiting in Connecticut Children's Medical Center's, you know, emergency department back in November. And I was following along with these stories, and by March, a few months ago, there, you know, sources were reaching out to me saying there's 20 to 30 kids. And then I would reach out to people, and then that number just kept increasing. And then in April, by the end of April, you know, I'm being told there's 40 kids in the emergency department who are waiting for care, waiting to go to inpatient beds at psychiatric hospitals. And then the highest day being, you know, 47 kids waiting in the department. And the question that, you know, I had for myself is like, you know, what's going on, why, and what's the issue? So for the last few months, just been talking to mental health experts and these doctors at Connecticut Children's Medical Center and at Yale New Haven's Children's Hospital about what they're seeing. And it's everything that, you know, you all have been saying, like kids are, it's a mix of, you know, year after year, they were seeing this increase of kids who were coming in for psychiatric needs, but, you know, the pandemic definitely exacerbated a lot of that, a lot of those numbers of kids who were coming in. And so, you know, they were hearing from kids that, they were seeing that kids didn't have that structure, and they were really structured that school provided them, and they were really struggling with that. There were kids who, you know, didn't see their friends for a long time, and they were really, that was something that was really affecting them. And then they're also seeing that, you know, how COVID is affecting their families, whether that be financially, whether that be, you know, they saw a sick family member, like kids are seeing this, and that, you know, it's affecting them. And so that's what this story is about. It's kind of, you know, looking at, not kind of, but it's looking at, you know, there's this surge of kids who are coming into these hospitals, at these emergency departments during times of the year. So April, you know, was told by, you know, the doctor that I spoke with that April is usually a time of the year that they're going to see a lot more kids come in, because it's the end of the school year. There's a lot of pressure that the kids are facing, that just kind of piled on from the school year. But, you know, a typical year, they wouldn't see 47 kids coming into their emergency department, and their 48-bed emergency department. So it's, the pandemic has obviously added on to, any stressors that these kids have had. So,
well, and maybe an important piece of this too is for people who haven't followed this issue in the past or haven't followed this surge of more need for psychiatric beds. Explain a little bit, Adria, about what happens to some of these kids when they come in and they aren't able to be seen right away. Where do they go? What do they do? Where do they sit?
Yeah. So a few weeks ago, a parent reached out to us, and this is the parent who, whose story, their daughter's experience that we follow in the story. And this parent reached out to us and said they really wanted to chat about what was going on in the emergency departments and his daughter's experience. And so for his daughter, when she did have to go to the emergency department at Connecticut Children's, he was explaining to me that his wife was really worried because there were kids in the hallways on stretchers waiting to be placed there. She overheard other kids saying, "Oh, I've been waiting in the emergency department for 5 days, 6 days." And there was a kid who said they'd been there for 10 days, and they were just really worried about, how long it was going to be until their child could go to the psychiatric hospital that she needed to go to. But for her, unfortunately, she was in the situation where the other kids were also in the emergency department. She had to wait in the emergency department at CCMC for 6 days. And during that time, there were repurposed exam rooms. They were, putting kids in exam rooms and holding them there. And he was just really explaining that, these exam rooms are windowless, and she's dealing with depression and anxiety. And it definitely was not a good environment for her. It exacerbated that. And so while he also explained, there are kids who continue to be in the hallways, kids who were in other exam rooms, and they did have time to socialize with one another, but it's still like, that's not an environment that the kids want to be in. And he was also explaining to me, and the doctors also don't want that for these kids either. And who are there also don't want that. So it's obviously, like, as I'm explaining, it's not an ideal situation. I don't think anyone listening to this is saying like that's ideal. And there's a quote in there from one of the doctors who were saying, like, we're doing the best that we can with what they have. And they're expanding by adding the exam rooms and trying to create space for these kids, but it's definitely not a great situation for them.
Absolutely not. And Laura, in your story, there's a bit of that too. There's some numbers about hospitals, not just in Connecticut, but you say Massachusetts, New Hampshire, Rhode Island. This same sort of thing is happening, right?
Right. Yeah, that's what people have told me.
And reading from your story here, visits among all pediatric emergency department visits rose from mid-March through October of 2020. Increases 24% among children 5 to 11 years and 31% among adolescents aged 12 to 17 years. Michelle, this is actually a really important point here, because we're talking about children. Children are, by our lexicon, people who are younger than the age of 18. But that's a pretty wide range. And there's a big damn difference between, emergency room visits for kids for psychiatric disorders who are 17 and those who are 5 or 6. And can you talk about that and the importance of not just saying this is a childhood mental illness problem, but this is a segmented problem that's very different depending on how old people are?
It certainly is. We have to remember that children develop over time, and the child development of an 11-year-old is going to be in a very different place than a 17-year-old. And I know the hospitals and the doctors really strive to provide care that's appropriate to the children's development level, but they have to have the resources available to do that. And if we know that there is a big problem with there not being enough mental health providers, even to get outpatient care, and the lack of outpatient care leads to more inpatient care. So if we are able to look at this as a system, how can we address the issues in a way that makes sense so that we have enough outpatient, enough inpatient, enough school-based social emotional learning to build resilience before they even get into outpatient care? So we have to look at all of the options, and we have to look at them developmentally so that we know that If you're a psychologist who works exclusively with adults, you may not understand an 11-year-old as well. So we really need some specialists who understand child development who are able to do that. School counselors and social workers and psychologists are great. They are at the front line, but they are overworked. They've got hundreds of kids that they're trying to support at any given moment. So we need twice or 3 times the number of them in the schools. Some of the American Rescue Plan money is going to be available to help provide more community-based mental health centers, and some of what's in the proposed education budget would really expand mental health services, but we have to look at broader societal solutions that are going to help build the system of support that kids need at all their different stages of development.
Randy?
Yeah, I'm so glad you said that, Michelle. I think we're constantly talking about crisis intervention, right? And yes, there is a complete lack of hospital beds. Our mental health system, if there is even such a thing, has been lacking for a very long time. We don't have enough child psychologists or child psychiatrists to meet the demand, and we certainly don't have enough children's psychiatric facilities or hospital beds for children, and emergency rooms simply are not equipped to handle children with psychiatric problems. So yes, that needs to be changed. We need to put more money into better mental health care and crisis intervention. But the truth is that Michelle's right. We have to look at the entire system, and what she's talking about and what we believe strongly in is early intervention and prevention. So how can we, if we're always focusing our efforts on the crisis that's happening, stopping suicide, which is very important, obviously, and getting help for those kids who are in crisis, we're just going to continue to spin our wheels. We need to start thinking about early intervention and prevention. And I agree with you, Michelle. Social emotional learning is one of the most important tools for early intervention. And for those of you who don't know what that means, it's teaching young children, and they can start learning in preschool, all about their feelings, their emotions, how to name them, how to react, and that all feelings and emotions are okay. There are ones that we want to have and ones that we don't want to have. Some don't feel very good, but they're okay to have those. So our generation, we weren't brought up to think that way. We were happy, mad, sad, right? And if you're sad or mad, get over it. But what studies have shown is social emotional learning is so important for children as they develop, learning how to express their emotions and feelings in a way that's healthy. That's a very big part of early intervention. And one of the things we strongly believe is teaching those skills to the parents also. So education in general is sorely lacking. Knowledge is power, right? The more we know about something, the more we can do something about it. So my son was actually 9 years old when he was hospitalized. He was suicidal. I had no idea a 9-year-old could have that issue. I didn't know about that. Nobody around me had these issues. So everybody thought it was a parenting problem. There must be something I was doing wrong. Why don't I try sticker charts? That would snap him out of it, right? And I wasn't given any advice or skills, nor did I have any knowledge. And so educating myself and diving into what is this thing that's happening to my child, like I would if he had a physical, condition like cancer, that knowledge is power. And what we believe in is part of the systematic approach has to be education, really understanding that mental health lies on a continuum, and we all have it starting at birth. Our babies have mental health the same way they have physical health. And if we don't learn about that, and I would say you can't get help for a problem you don't know exists or that you don't understand. If you don't know to look out for a problem, then how do you catch early warning signs? So anyway, I could go on and on about that, as you can see.
It's obviously it's very important, and it just makes me think of a question here. And again, if you're watching and you want to take part, you have a question, you can enter it in the Q&A function at the bottom. Michelle, John asks, about the history of child mental health. And I think what he's getting at is obviously children have always had mental health issues and crises that they've had to deal with just like adults. We just really started paying attention to it only very recently. And I don't know, Michelle, this is a really important point. As far behind as we seem to be as a society in thinking about mental health for adults being on par and in parity with physical health, we seem to be even further behind in considering that problem for children.
I think that's entirely true, that we've only as a society moved away from the thought of children as property in recent years. The move away from punishment, from physical punishment in schools and in other places has happened in my lifetime. And honestly, not in every place in the entire country, in every home. So we know more over time. We also know more about how children develop, how the brain develops. Science has taught us so much in the last 20 years about how children's brains are affected by trauma, how resilient they can be, and how they can recover from the worst injuries. And we also have to start thinking about health as kind of a continuum of health and injury. If we had an injury, we would go to the hospital. There's no stigma. You go and you get your arm broken, you get your arm in a cast, it gets fixed. If you experience trauma, you need to see a health professional that can help you heal that mental injury, that emotional injury. And we need to take some of that stigma away from it. And by saying and putting it in a historical context, there are plenty of people who think, oh, when I was a kid, we used to do this and I turned out okay. And that's probably true. But I can tell you there are lots of people who didn't turn out okay who experienced that. And we're learning more and more how to do better. In the same way that my grandparents started working in the mills in New England when they were 12. They left school and went to work full-time in the mills in dangerous jobs. We don't allow that anymore. That's child labor. We need to look at children's development and figure out how we can support them to be successful and happy and self-sufficient and contributing members of our society throughout their lives.
Can I just add one little thing, John?
Yeah.
Because as you were talking about the history, I think it's really important to recognize also that we live in a very hyper parenting society these days, and certainly in the past 20 years, where we were taught to believe that a child's behavior is directly related to parenting, that you had to teach your child how to behave. And if you could not teach your child how to behave, usually, corporal punishment of some kind, then there was something wrong with you as a parent. And so we really talk about stigma in terms of blame and shame, how we blame ourselves, we feel ashamed that we can't fix our kid. And so we kind of isolate and try to go it alone. And the teachers and the pediatricians say, well, have you tried a sticker chart? As though a sticker chart is what's going to help, right? Or consequences or punishment. And those old ideas of parenting when it comes to our children's mental health simply don't always work. And we have to move away from this idea that it has to be the parent's fault. But back towards what Michelle was saying, understanding the whole child, the development of the child, and what we can and cannot do as parents to help them build resilience and to help them through traumas such as COVID, which will be a very big trauma for an entire generation.
So we have a bunch of questions coming in, and I'll just I'll throw them out here because I want to make sure we get to as many as possible. An anonymous poster asks, so where can children go now for help if therapists are overworked and not accepting new patients because of the increased need? I mean, what services are out there? I guess maybe Michelle, quickly, I'll start with you, but what do you see?
We definitely know that we need more services, and the expansion to telehealth has been somewhat helpful this year. Certainly there are some children who benefit more and are more comfortable on that type of a platform, but we also know that some therapy works much better in person, and we have to be able to find those people. And one way to do that is to contact through the schools. The schools have professionals that can help you make referrals, to contact other government agencies. The social service director in the town sometimes can help. Contact community-based health centers. They can often build connections. So there are support services and ways to start those connections, but it's horribly frustrating when you try and cannot find the right support.
Look, Laura, I'm just wondering if you could pick up on this a little bit, because you in your reporting, you report on the Trevor Project using AI. You write about online therapy. Some of these tools, as Michelle said, really can work. What can you tell us about what you learned?
In terms of how virtual therapy is helpful
Yes.
to people?
Yeah.
Yeah, I would say accessibility was a big thing that I heard from people in terms of touting the benefits of teletherapy or virtual services. Flexibility, like the AI supplement, training for crisis counselors was implemented because a lot of the volunteers, their volunteer crisis counselors, were only available on weekends or nights when, trainers usually aren't. So this AI would come in and train them on these nights and on these weekends. I would say also for people, stigma too, it helped. People who didn't want to have their neighbors see their car parked outside a mental health center could just log in on their phones and talk to a therapist. They didn't have to wait in a waiting room and have anxiety, with that, associated with that. So those were the benefits that I was hearing in terms of virtual services.
We have another question here from another anonymous poster who asks, what about children with autism that don't respond well to social therapy, specifically in a clinical setting? This is important, Randy, because as we've said all along, mental health is a continuum. We read quite a bit about the autism spectrum. That is not a fixed point, certainly. And this is one of the mental health issues that many children and their parents are facing.
Yeah. So your what was the original question? I'm sorry.
The idea of children with autism that don't respond well to therapy in a clinical setting. Not all settings are exactly right for all kids, and that's not just for kids with autism, but that's for all kids.
I think that's true. I think it's for all kids. I think that we have to, again, getting back to this, my mantra of knowledge is power, understand that treatments are different. There are many different types of treatments, first of all. There's cognitive behavioral therapy, dialectical behavioral therapy, there's EMDR. I mean, there's a list of different types of therapies, and it seems like it's a growing list as we do more and more research and learn about the brain. But also to think outside of the box a little bit, because what works for one person isn't going to necessarily work for someone else. So one child with autism, and the autism movement has made a great staying out of, if you've met one child with autism, you've met one child with autism, meaning they're all different, right? All of our children are different. And so what works for some may not work for others. So there are a lot of different things to explore. Nutrition, exercise, meditation, mindfulness, yoga, trying nutritional supplements, eliminating red dye. I mean, I'm throwing everything out there because I think as a parent, we try everything. You try everything. And again, something that maybe worked for my child isn't necessarily going to work for your child, even if our children have the same exact diagnosis. There's also a lot of controversy about medications. And I think each family has to really discover what feels right for them in their own situation after trying the different things that they can try, and not to give up is, I think, the biggest thing. But knowing that you're not alone, I hope is very helpful. It was very helpful to me when I was a parent of young children, and finding out that 1 out of 5 kids struggled and that it wasn't just me really shifted my perception. And that's when I've been doing this work now for 15 years. I started a parent support group out of my house when I lived in Westchester, New York. And what I discovered is there's so many of us, but we're so afraid to talk about it. Not public soccer field conversation or playground conversation. And sometimes the best resources you can find are from other parents, meeting with other parents who have children with autism, who have children who have struggled with anxiety or depression or bipolar disorder. Those parents who have been down that road really can help so much in guiding you towards finding resources. And that's one of the things we do with the Parent Support Network, which we've expanded actually into states all over the country. Now, because of the virtual, we're talking about technology, has allowed us to support parents in every state in the country and gather parents together to help each other. I think it's a really vital part of searching for resources.
Michelle, actually, since Randy's talking a little bit more about the Parent Support Network and some of the work that she does, I mean, maybe you can explain a little bit. We talked about social emotional learning, which is something that you're very involved with. But what sorts of services does the Connecticut After School Network provide?
So we provide training and technical assistance for people who work with children outside the traditional school. But we're also part of a number of different national collaborations, both in terms of after school, but also in terms of social emotional learning. The larger organization is called SEL4US, the number 4, and that's a .org. There's 20 states that have groups that are trying to provide additional systemic supports to build more social and emotional learning within schools, within community settings, so that kids are able to build their resilience in the long run. They're really looking more at systemic issues. So we started down this road because we were hearing from people who worked with kids, we need more help, we need more training. We need to develop not only the behavioral health workforce, but the workforce that works with children. We need to develop teachers and paraprofessionals to understand some of these mental health issues. We need to support doctors and nurses and physicians assistants to be able to serve in this capacity better. So we need to think about what types of trainings and support that the people who can help can do a better job to help. And that's part of what we do.
Adria, I want to get back to you because part of our focus here is of course, finding solutions for all of this. And some of the reporting that you've done is remarkable. Spending months talking with parents, hearing some of these stories, but you certainly did hear from people about what's needed more in the States to solve some of these problems. Adria, what are you hearing from people? What do you think is needed to help?
Yeah, one thing that, I can think of that immediately stood out to me, and we just talked about, kids with autism and kids with, disabilities. That was something one of the doctors I spoke with mentioned, that they'd like to see more specialty care facilities in the state. So one of the points in the story is something that one of the doctors brought up, is that they're seeing a lot more kids come in who have eating disorders. And so that takes bringing in a nutritionist. They have to have, be on a specific diet. And if you have a kid who's in the emergency department with an eating disorder, you just don't have, the staff or the resources in that department for them. And if the facility that's, does exist in the state is essentially like backed up, then there's just a need there. And so that was like one of the things that came up, was just if we could get more specialty care facilities for kids who have eating disorders, kids who have autism, and kids with other disabilities, that would be extremely helpful. And then there was also, they mentioned that wanting to have this conversation and have screening start with pediatricians. That came up during conversations. Then they brought up that pediatricians are talking to kids about mental health, but if it was every pediatrician, when a kid goes into a checkup, to just ask about their mental health, that would also be kind of an early intervention, like we were talking about earlier. And that's something that the doctors think that would be helpful and like to see implemented.
And that's not standard practice for a pediatrician necessarily to be asking those types of questions of a 5, 6, or 12-year-old.
They don't have the training is what it comes down to. And Michelle's exactly right. Systematically, we need to bring in more training to teachers, to nurses, to pediatricians, to the police force, right? And to parents as well. Our entire adult community needs more training, needs more education and knowledge. Not just, it's great that we're having these conversations and we're bringing about more awareness, but we really need to understand more specifically about what to look for, what are the signs, and what are the right questions to ask. So training is absolutely essential in all of those areas, and something that we just have ignored when it comes to how can we, if we want to improve these systems, we need to bring more training about kids' mental health into our communities overall.
And I
Go ahead,
think
Michelle.
it even goes beyond training, because while training is important, we need to see that this is not an individual problem. It's not an individual family's problem. This is a
Right.
societal problem, and
Right.
there are societal solutions that we need to address. So, for example, I sit on my local school board. We did not have adequate number of mental health professionals in the community to support children's mental health needs. We were hearing it from the parents. Some parents came to the Board of Education and said, "What can you do to help us?" School staff came to the Board of Education and said, "We need more help. There's more going on here that we can't provide. And kids aren't going to learn if they have these other mental health issues going on they need help dealing with, and they can't get the help they need either for lack of insurance or lack of providers." So we were, as a district, able to find an organization that will come into the school at no cost to our school system, provide mental health services on site, taking insurance from those parents who have it and not billing for insurance if they don't have the access, to get the kids the services that they need. But it took people standing up and voicing their needs to people who could make the decisions. Right now, there's a whole bunch of American Rescue Plan money coming into the states from the federal government. The State Department of Education is asking for feedback. What should we do with this money? People could, answer those questions now, could get back to the State Department of Education and say, "I know exactly what you could be doing with that money, and here's my ideas."
Yeah, and it's a grassroots effort, Michelle, right? I mean, what you're
Absolutely.
talking about is parents, because
Mhm.
school districts are afraid because they don't want parents yelling at them, right? They don't want the parents coming after them saying, "You shouldn't be talking about this to my child," right? What we need to do as parents is stand up and say, "No, we need you to be talking about this. We need this training. We need this help. We need the supports." And if we as adults in the community, parents, teachers, pediatricians, gather together and knock on the door and demand that these services be brought in, and we demand that money gets put into it, then we'll get somewhere. But we have to do it together, right? We have to band together to get that done.
I want to get to a few more questions, and we've got a lot of different questions coming in. Chandra wrote in and said, "What can be done to apply these responses of compassion and treatment to Black children and children of color who traditionally have been labeled, quote, bad, disrespectful, etc. Now, white parents are experiencing some of this," she writes, "which might help some, but what else can be done?" This is another incredibly important issue, right? There's differential in the way that students are treated. There's a differential in the way that patients are treated, depending on the color of their skin. And this is an especially acute problem for young children of color. How do we address this? In Chandra's words, how do we help to apply these responses of compassion and treatment to Black kids who don't always get that treatment?
So I'm so glad that Chanda asked this question, especially in this way, because we have to look again at systems that are affected by bias. And training can help support some of that, but we also need to build and recruit a whole workforce in the behavioral health that have a wide variety of lived experiences, because not every therapist is going to connect with every child. And we need to have as many different choices for families to access services and find the right connection that can help their family. So there's more to this than just finding, the one person that can help your one child. There's really a bigger system that we're looking at, and the attention that's being paid to it right now is really essential, because so many children have been harmed by, labels of being bad or disrespectful, and not being treated well by the systems that they rely on for support.
It's actually a huge, massive, and complicated problem. And it's an excellent question. I think we could do like 3 hours just on that one question. So, I mean, because it's complicated and we need more diverse voices and faces, and we, you know, because the experience in communities of color is very different, and how do we approach it in a culturally competent way? We need to figure out ways to increase the diversity of our organizations, of the input that we're getting from different communities. So it's a great question, and I wish I had the experience to answer that question, but I'd love more people to be involved.
Christina writes in, and I think she's responding here to something that we said about pediatricians maybe not having the tools necessary to deal with some of these issues. She writes, there are screening tools that we use in our pediatric practice. Often the issue is finding therapists who can see the children when they need more care than we can provide in the office. So, and again, it's going to vary from pediatrician to pediatrician and office to office, but it seems, Randy, as though really that's the struggle there. Maybe the pediatrician knows that this is something that needs to happen, but we just don't have the referral.
And the teachers will say that too. The teachers will say, you know, we see the problem and we could tell that if we even feel comfortable talking to parents, where do we send the parents? Where do we even send the child for help? And again, that gets back to, we have not valued this enough to put money into the resources we need to support our children, to get them the treatment they need. And I would go back to, and Michelle referred to this earlier, there are a lot of different places to search, but how do you know even how to begin searching for help if it's something you've never dealt with before? And I would recommend, again, searching for other parents who have gone through the path in your community, because I think we as parents are our own best resource. We find our orthodontists from each other, our pediatricians, what's the best camp to go to. It's really the same. We need to band together and be able to find people like us who can give us the direction that we need to find resources. It's almost impossible to find. And what we were talking before about hospital beds, I mean, it's a crisis. There isn't enough help, but that doesn't mean we shouldn't work as hard as we can to find it.
We have
to keep trying.
Yeah, no, we have a few more minutes left, and we just have a few more questions left. Somebody writes, this is definitely an issue in schools. If a teacher notices a problem, they're not allowed to communicate to parents that they think that there are red flags for issues like ADHD or others. If they did, it could help treat issues earlier on. Is this changing at all? I don't know, Michelle, this is a big issue. My wife's been an educator for years and years, and there's this very fine line that you walk as an educator about what you can and can't say to parents and how much you're allowed to, quote unquote, diagnose a problem. But if indeed the schools are the places where kids spend so much of their time and they have all these particular resources maybe at their disposal, how do we make this something that actually might work a little bit better? Because obviously we don't want to put teachers in the position, being untrained, to have to recognize these things.
And that's why I mentioned earlier about the need for more school counselors and more school psychologists and school social workers, because they're there to support the teaching staff as well, to take a hint from a teacher and actually do an assessment and have some of that discussion and have the more ongoing discussions with the parents. But if they're seeing caseloads of 400 kids per counselor, how are they impossible to have a conversation with a kid for long enough to be able to even diagnose them, let alone do what they need to do? So some of the funding, and I've seen at the state legislature here that they're paying attention to those types of caseloads, but we really need to invest and put our money where we know will do the most good. And schools are one place where we know most children are, where most children go. They don't have to travel to get to services. If you can bring the services to the kids in the school, they have more instructional time because they're not driving to and from the therapist in the waiting room, whatnot. They're not, as Adria described in her story, they're not sitting in the emergency room or a treatment room waiting for help. If we're able to address the help on a more timely basis, we might be able to start to make some headway against this.
The problem with that, though, is that it's going to take so long to build those resources. And while I 110% agree that is exactly what we need to do, the caseworkers for the guidance counselors and the social workers and the school psychologists, there's not enough time in the day. And so what a lot of communities are starting to do, and they're starting to see some success, is I get back to bringing parents and teachers together in ways that they learn the same language so they can talk to each other. So I hear a lot that the teachers will say, well, the parents just don't want to hear it, or they just don't get it. And then I hear the parents say, well, the teachers don't get it. They won't listen to me, you know, and there's this gap in communication. Parents are afraid to tell the teacher the truth. The teachers are afraid to tell the parents the truth, and so on. And so community education, again, is really, really important. You can't, if we don't break the barrier of this silence, then we'll never get anywhere. And I'm not saying education is the only thing, but how do you even get to anything if we're going to be silent about it? We can't get to more funding and proposing more social workers in the schools or school psychologists if we stay quiet about it, and we're all suffering in our own little silos, and we're embarrassed to tell the teacher that our child has a diagnosis, so we just don't say anything. Or there just has to be more open, honest dialogue and communication, community conversations and education. And I think you have to start there, because without that, you can't get anywhere.
Before we run out of time, Laura, what other issues are really interesting to you around this? I mean, what else do you want to cover? What stories do you think are really important to tell around these important issues around children's mental health?
There are so many of them because it's such a nuanced issue. I think I like solutions journalism because I think it's important to highlight the good that's going out there, and hopefully other organizations can see it and replicate it. I think that's the idea behind the solutions journalism. I went to a press conference this morning where a mental health agency is co-locating physical health services in with their mental health facility, which is great news. And, something I learned that is important to have that co-location of services when I was doing my reporting on this story. So, I want to follow strides in the mental health realm like that, so hopefully other people can hear about it and it can spread.
How about you, Adria? What other stories are on your plate here?
Yeah, I agree with Laura that there's just so much. And a lot of the questions that were asked tonight are definitely things that I've jotted down as I wrapped up this this story about what's happening in the emergency department. So, whether that be like following legislation, seeing how much this, the governor's proposal to spend the federal dollars will, actually help, like how much of that is going to help and have an impact. And then also Chandra asked the question about, how you respond to Black kids. And I am very interested in looking at that in Connecticut and how, the mental health crisis looks different for kids of color, because it absolutely does look different. I know from, personal experiences, but also just, hearing and seeing different stories that have been told nationally too about how, different this last year has been for specifically Black and Hispanic kids.
How does it look different, if you can put a finer point on it?
Well, on top of having to deal with the pandemic and all the issues that we've talked about during the pandemic, there's also been heightened conversations about, violence and racial violence specifically. And I'm like, I don't know how else to explain this, but when you see, last summer, all the people who gathered and protested and to, call out the murder of George Floyd. And kids are watching that. Kids are seeing this. Kids watch the Derek Chauvin trial. Kids are paying attention to what's on the news because they're on the internet. And when you have that on top of, being in a pandemic and you're a Black student trying to figure it out, and school and and, the way you interact with school might be different compared to, your peers. So just looking at that and how, seeing that through social media and having to deal with that this last year too, on top of, this drastic change with school, that's going to be a different experience than, their peers. So that's something, and I know it was a different experience for me personally. So I'm very much interested in just seeing just how this has impacted those kids specifically.
Yeah, it's been a heavy year for an awful lot of people. I really appreciate all of you taking the time to talk about some of these issues. And I really want to thank Adria Watson and Laura Damon for the continued great reporting on this issue. Adria with the Connecticut Mirror, Laura with the Newport Daily News, and working with all the Gannett newspapers across New England. I want to thank you very much. Thanks also to Randy Silverman and Michelle Doucette Cunningham. Thank you for your expertise and for all of the great answers and the thoughtfulness that you brought to this conversation. I really do appreciate it.
Thank you for having it, John.
Of course, absolutely. We're thrilled to do it. I want to thank Katie Landeck and Aaron Dion at Gannett for all of their assistance in putting this together. Thanks to Bruce Putterman, Kyle Constable, Courtney Gavitt, and Amanda Kenny at the Connecticut Mirror. And thanks once again to the Solutions Journalism Network for their support of this project. We can't get to all the solutions for every problem that we talk about, but hopefully we can get to a few and have it be a resource for people moving forward. Thank you all for spending some time with us tonight. We're going to have this event archived on the Mirror's website at ctmirror.org/events, and we'll have more conversations like this coming up in the months to come. Thank you all so much. Please have a good evening.
Thank you.